So thank you for coming back to the clinic. We did your first Kybella injection about 6 weeks ago, and are you able to tell any improvement yet?
Yes, I can tell that it's tighter.
Well, good. And are you ready for your second treatment?
Yes.
Good. So you can see we're trying to get rid of this submental fat here, or chin, and we're going to lie you back and let you get comfortable.
Okay.
And we're going to give you some squeezy to hold on.
Oh, I did like these, by the way.
Good, good. And I'm going to tilt you back a little bit farther. And then the first thing we're going to do is I'm going to put on my gloves, and Alondra is going to put a drape on you.
And for those of you that do not know, Kybella is dechloric acid, which is a medication that we inject into the submental fullness that dissolves the fat. It immediately will dissolve the fat and cause an inflammatory response that will then also tighten the skin there. In the clinical trials, patients were satisfied after 3 to 6 treatments, and this beautiful patient has only had 1 treatment and she is already seeing results. What Dr. Sandy is doing right now is she is cleaning off the area with a surgical scrub soap that will prevent infection from the injections. After she's done cleaning her off, she's going to mark certain landmarks on her. This shows us where it is safe to inject. This is one of the reasons that it's really important that you have an expert injector, because this medicine, when it dissolves fat, it can also dissolve the sheaths around nerves, which can cause some nerve damage. Luckily, Dr. Sandy and I are both medically trained with Kybella, and we haven't seen anybody have these adverse events that they talked about could be possible after studying it. So right now she's marking out her mandibular line because you have 2 nerves that run along your jawline here that are what make you grimace. And so if those nerves were injected, it could result in an uneven smile.
Can you grimace for us to show us?
So she would not be able to do that as
Great.
strong. Luckily, if that were to happen, it is only temporary, and after about 6 months, you would have back the regular strength there, that nerve would be regenerated, and your smile would be even again. So it would be a temporary side effect. But it's still important. After Dr. Sandy injects her today, she will have some what we call paresthesia, so you can have some numbness and some tingling there, and you will have some swelling. We usually tell people to expect the swelling to be worse the first 24 to 48 hours, and that swelling will then go down over the next 4 to 6 weeks gradually. People usually notice the swelling initially that first day or 2, but then after that, you can't really tell, even though it's just a gradual going down of the swelling. The swelling is a good thing because it's that inflammatory response that's tightening the skin where the fat was dissolved. Most of our patients say that they can tell that they're swollen and they feel very swollen, but that no one else really noticed they were swollen. What Dr. Sandy is applying now is a temporary tattoo, just like you could buy at a carnival, and it shows her exactly where you would inject the Kybella. So you'll notice as Dr. Sandy is injecting the Kybella, she's going right on a even spaces apart because that tattoo shows us exactly where to inject in the safe zone. And we'll wash that off her before she leaves the clinic today. So that's a pretty simple step, and that ensures that we're safely injecting you and doing no harm first. So before Dr. Sandy starts injecting her, you'll notice that she is going to be injected with lidocaine. The numbing medicine will prevent the Kybella injections from hurting while they're dissolving the fat.
Here we go.
I had ice before this last time, didn't I?
You did have ice before.
We'll
last
get you
time.
some ice now. Wonder, can you hold ice on her other side before Dr. Sandy gets her other side, please?
So right now we're injecting the lidocaine with epinephrine, which you can tell she's not very happy about. She has asked that we make this as comfortable for her as possible. So we are injecting a lot of lidocaine before treatment. And you can tell the lidocaine's working now because it's a little more comfortable, these other injections.
The ice helps with the pain and comfort, but it also helps with the swelling afterwards. So we tell people to continue that tonight.
When you continue the ice, it's important to be careful, because this area will be kind of numb from all the reactions. And so you don't want to put ice directly on it or else you could get frostbite.
Usually tell people you can ice the area for up to 20 minutes of every hour. And so a lot of people will time themselves because you have that numbness and those paresthesias that we talked about. You could very easily hold the ice on for too long, and that's what Dr. Sandy was talking about, getting frostbite. So you won't be able to feel if it's too cold. So you just hold the ice there and time yourself for 20 minutes of every hour, and that way you can assure you're not holding it on too long.
Great.
Believe it or not, that ice hurts worst of all, so you won't put it on there for more than 20 minutes. Because even after you have it done, all that night, it's still, the ice hurt.
It did.
Yes. There wasn't enough numbness that it didn't, not hurt. It was just, my son could not believe when I told him the most painful part of it was ice. He looked at me like, I think you're lying to me, Mom.
So if you notice the area is a little bit white where she's injected the lidocaine, that's because we mix our lidocaine with epinephrine, which makes it last longer. We also have it with sodium bicarb so that it's less painful when we're injecting it. So this is the actual Kybella injection. So as Dr. Sandy is injecting this, you'll notice she's not flinching at all. This does not hurt because she is already numb in the area. So that Kybella that Dr. Sandy is injecting is just immediately dissolving the fat there, which is our goal.
But it does look horrible afterwards.
Yes. So like we were saying, tonight she is going to be pretty swollen. So we tell people if you do want to get Kybella to dissolve your submental fullness, plan to be injected before, like not before any big events or any hot dates that you don't want to be swollen for.
And that's at least, if you don't want to wear anything around your neck, that needs to be at least 2 weeks, bare minimum, I think. I have a big wedding I'm going to July the 30th. And I just went to a wedding Saturday, so I had to make sure this was in between those.
So as you're watching, you're noticing quite a few injections of the Kybella, but compared to a surgery to have a neck lift or liposuction, there's really no downtime. So she's not having to go under anesthesia. She's not having to wear any garments after this. She just comes in the clinic, is injected, and then goes about her business.
I was back at work the next day.
Right.
Good. Was anybody at work able to notice that you were treated?
Yes. But I had that, I really have a lot of bleeding from things. Just normally I have a lot of bruising. So I had a lot of bruising in my neck. That's why it was so noticeable.
And everyone is, like you said, a little bit different when it comes to bruising. Some people tend to bruise more than others. But if you do have bruising, there's some things that we usually will recommend. One of those is the pulse dye laser, and the pulse dye laser will target those bruises and make them go away quicker.
I had 2 of those.
Yeah. The other thing that we will usually say is to eat pineapple or watermelon that have antioxidants. That will help with the bruising. And then, of course, the icing tends to help. There's also a homeopathic gel and pill that you can get at most drugstores called Arnicare that you can use the gel up to 4 times a day, and that helps with bruising to go away. And some people will recommend that post procedures like this to decrease the bruising. And it's pretty low risk.
Nina, you also was treated with Kybella.
Yes. Yes.
And we were one of the first 10 chosen in the state of all cosmetic injectors to inject with Kybella. So we've had quite a bit of experience with it, which I think is important. I'm sorry that's uncomfortable. We're getting outside of the lidocaine. Great.
So somebody asked what we're doing right now, and we are injecting Kybella to dissolve submental fullness, which a lot of people will call the double chin. And so this is her second treatment. The company recommends 3 to 6 treatments of Kybella injected once every 4 to 6 weeks to dissolve submental fullness or double chin. She's already had 1 treatment, and she can already tell the difference of her fat being dissolved and that skin being tightened. And we will keep injecting her every about 6 weeks until she's at a level that she's satisfied and her double chin is tightened to where she's satisfied. And so if you're just now joining us, you can see where we actually injected the dechloric acid or the Kybella, and she is a little bit swollen there, but this is an alternative treatment to surgery. So this is for people that don't need or don't want a neck lift or liposuction for under the chin or for submental fullness. This is a procedure where you come into the clinic, we numb you up with lidocaine, we inject you, and then you go about your business. So I hope you guys enjoyed watching us inject Kybella. Dr. Sandy, do you have anything to add?
Thank you for your interest. How about you? Do you have any questions or comments?
I would say, I don't think I'm a wimp, but I don't think I can stand tons of pain. You saw me. There was no whining. It's not the most pleasant thing in the world, but gosh, is it great for the results you get in the end. So I would do it again, and I'm gonna do it again. I'm gonna have at least 1 more treatment, and that's bare minimum. And I wouldn't think twice about having 4 or 5 if I had to.
But you like the results so far?
Yes. There was a lot of tightening, and I have lost a lot of weight at one point in time. So I had a lot of loose skin there, not just fat there. Mm-hmm. I had a lot of loose skin, and I've seen quite a bit of tightening too.
Oh, great.
So it's done me a good job.
Well, great.
If you guys have any other questions, I would encourage you to email Danny at johnsondermatology.com or call the clinic.